Ron Oberleitner, has spent more than 3 decades innovating in the medical device and autism healthcare fields. As chairman and CEO of Behavior Imaging Solutions, he's developed award-winning telehealth systems used in classrooms, homes, and for Alzheimer's care. Today, he's leading NIH-funded research to bring these tools into hospitals, helping staff provide better care for autistic patients. His work is deeply personal. Ron is a proud father of Robbie, his adult son with autism, and is committed to transforming hospital care for individuals like him. Take it away, Ron.
Thanks so much, Josh. And just wow to my fellow panelists. The quality of those presentations and helping us see that there are strategies that we can kind of build on to help these kids is just deeply moving and something that I could not communicate half as well. Um, Josh, you can go to my next slide there. Let me give you a little context of how I'm connected to this important topic and this fantastic panel. My day job back in the 90s was leading product development for a company that was building solutions for surgeons to use in hospitals. For any innovation that we were considering, the surgeons in the hospitals demanded, of course, not only better outcomes, but the things that are also were important is could we save the surgeon maybe minutes of OR time? Could we get the patient out of the hospital sooner because of the innovation we were introducing? Could the hospital team use this innovation in its current workflow to be able to support the patients? And the important other context is that our inspiration, and when Sharon and I founded Behavior Imaging, was our son, Robbie. He's 32 now. He's had the kind of cases that Dr. Friedlander was sharing. And as we were working on other solutions to help autism care for schools and everything, at night, on weekends, and the worst time possible, he would have behavior crises, much like was explained earlier. That and sometimes you never know as a parent exactly for a nonverbal child who's in distress, is it something that is life-threatening or not? And you just get a sense that first, hospitals are typically the last place we think is comfortable for our son with autism because of the factors my fellow presenters brought up. But when it's a crisis and you think that your child is going to be harmed or even die, the hospital is the only place to go for our kids. We've been to hospitals, and when I was looking for a picture to share on this, unfortunately, I have hundreds of pictures of Robbie in hospital gowns. And that's because part of his whole existence is pursuing optimal health. So, times that we go in for a crisis, 9 out of 10, it's a very stressful job, not only for him and us to support him, but for the healthcare workers who really don't know the autism parts of his challenges, but they know what to do to seek if there's some medical underlying position. So 9 out of 10s we'd come home without knowing what really was causing this distress. But the 1 out of 10 time, we had a situation where he had pica, where he ingested quarters, and for 4 ER visits wasn't detected, but by the fifth time, um, they detected that, and we had to go for a special GI um, intervention that pulled these quarters out that were at least there for 6 months. That could have been life-threatening, if not just totally debilitating for his health. And we were lucky. We were lucky because we have access to healthcare like that. There are many families who are having these distress situations that don't have access to a hospital care like that. Or sometimes hospitals have told people, we can handle your medical situation, but the behavior is something we can't handle for this patient. You might go to the next one. And families have been turned away. So this is such an honor that the NIH recognized that this was an issue that we have a solution we could suggest. Challenge that we're going to work on in this grant that we just received is develop a system of care, virtual care platform that we call Hospital Tele ABA, and that is to provide this kind of expertise to these patients. In doing so, first of all, we have a lot of expertise in developing virtual care platforms for different kinds of applications to help people help as students in school-based environments, even to get them diagnosed from data they can send from their homes to diagnostic clinics. We have a great relationship with many funders who see what we're doing as ways of being able to change systems of care for various aspects of autism care. And to do so, one of the places we start is to see where are the systems of care for virtual care platforms already successfully changing the trajectory of patients in crisis who come in. And there's some great examples in medical site that are showing that use of a virtual care platform, and specifically in this case, using real-time telehealth, can bring, for example, for a stroke patient who just comes into the ER, teleneurology can be available within the first 3 hours of a patient's entering that ER. And that specialist can be able to help the ER doctor and the hospital team do live assessments in that critical time to be able to set a plan for treatment for that patient. These systems are already available where it is unfathomable for many hospitals to afford a neurologist, especially in a rural or community-based setting. The teleneurology model is filling in that gap. And a service like this also can help on nights and weekends when the neurologist, even there was one locally and on site, cannot be there. But there's also other virtual care models that are being used routinely that just weren't here 10 or 20 years ago. Language translation is another one where, now we can beam anywhere next minute for somebody who speaks a foreign language to be able to get access to healthcare here. We have a real telehealth utility called BI Live that has ability to help behavior analysts via telehealth be able to collect incredibly important data for the behavior management of the patient when they will use this in the hospital setting. And then the asynchronous telehealth that Joy referred to is another incredible boon to services that hospital are able to provide. So for that same stroke patient that comes in, a CT scan could be taken right away, and without needing to have a radiologist on site, teleradiology can be accessed within those first 3 hours and be able to help guide treatment. That model of using diagnostic imaging in a teleradiology point of view is so ubiquitous anymore that it's referred to as radiology. And we have an innovation that has been used for school telehealth that can capture images of behavior that behavior analysts can extremely benefit from if they get to see it even after the fact to be able to guide the supports and treatment of that. And it's a product called Behavior Capture that will be added to this project as well. And then there is a formal pathway going where hospitals recognize there needs to be a transition to home type of a program. Get the patients safely out of the hospitals, let them rehabilitate at home with some guidance and support. Medical conditions I'm showing here on the left-hand side use tools and access of telehealth, for example, in the transition support column there to be able to make sure that a patient safely rehabilitates at home after intervention in the hospital. And you can see the outcomes that they provide. They're shown in the research, lead to fewer admissions and improve recovery, reduce ER visits. The Tele ABA platform virtual care system that we are going to be developing and bringing into the hospital environment will provide those same sort of outcomes, is the plan. And so, what I would like you to picture, when I first showed you that patient journey and how complex it is, if we had a virtual platform service available that hospital staff can access when a patient first comes in the door, and we're going to start with the patients in crisis here. They're brought in either by their parents or maybe another way. Um, the intake coordinator, an ED doctor, the nurse who's taking care of the stay that the patient needs to be in the hospital can access these BCBAs or autism therapists through the hospital tele ABA platform. Services that Natalie and Joy kind of referred to that BCBAs are able to do can be done supported virtually, sometimes supporting an on-site either nurse or a behavior tech that can interact on behalf of the patient, or the caregiver that might be staying with the patient can interact with that remote behavior consultant to provide these behavior type services. The attending doctor can get recommended behavior reports about how the behavior assessments that might be done are occurring, and what recommended discharge uh, recommendations might be should the patient be safe to leave. And then the uh, model that says home telehealth is our transition to home solution that says that same behavior consultant can meet virtually the patient with the caregivers after their discharge to keep supporting their rehabilitation in home, including trying to access resources in the community and other types of solutions. We are heading to our first clinical research study that we're going to deploy a version of this system that is going to allow the behavior analyst who's depicted here in the middle to be virtually off-site and to be able to say when a patient comes in, they can do an intake virtually with the patient and the caregiver, whoever is there to kind of add some context to it, can help develop a behavior guide based on that to support either the nursing staff during daily care, or a behavior tech that can facilitate some of the ongoing assessments or uh, exercises that might be helpful while the patient is there. Collecting data about understanding the patient's needs and also their skills, that once the attending can get a discharge plan recommendation from the behavior consultant that says, if they continue their behavior treatments or so at home, consider having their ongoing supports after their discharge. Well, our project will also arm the families to go home either with a tablet where or they can use their own phone account to be able to have ongoing support with that behavior consultant. And the um, the research that we're going to be doing is, if you had support in the model that I just described, will behavior incidents be the same or less as if a BCBA was there in the hospital, like Natalie does so very well? If we can be similar to that, then we can see that it's got promise, and we know it will. Secondarily, but as important to what the role is for the hospital and families and everything, is to also see, does a support service like this impact the length of stay? We hope it really reduces it significantly by giving options for post-discharge care that don't exist yet. We also think that it should reduce the likelihood for revisiting for similar situations because of that continuity of care that the behavior consultant will be able to provide the family after their discharge. And we are hoping and expecting that the hospital staff and the families see that supports like this make their roles that much better and easier, and that there is some other expert uh, supporting their journey successfully in the hospital. And we want the hospitals to be celebrated for providing solutions like this for these patients. I just want to make a comment about another term that hospitals are starting to think about, and that is how to deliver what they call hospital at home services. An example I have on the left-hand side is for cardiac care. We can outfit patients with instruments that hospitals can remotely observe when they're safe, and they can be at home when it's triggered for them to come in. We can provide hospital at home solutions for the autistic patient in the future as well, to either, like Natalie shared, that can train patients before they come in the hospital how to be, successful and do that, or again, be able to maybe in some cases be treated totally remotely by the hospital staff because of the behavior essence of these visits. So keep in mind movement towards hospital at home models that we also want to be um, uh, providing a solution for. And that would also help patients with autism that have non-urgent needs but need medical care and currently are not getting it because of stress of that. And just to end, I think as we kind of move through a plan like this, where we have a system of care model that we're suggesting is possible with hospital tele ABA, it's going to be a new day for autistic patients, where going for healthcare visits is not going to be the primary thing that they're doing, but they'll use healthcare the way we all do. And they might be able to be supported remotely, and when they need to go into a hospital, they won't be needing to stay through a traumatic experience for all. We also think this is a better way for hospitals. We hear in the research that hospital workers want this sort of expertise from the BCBAs, from other specialties, not only during the work days too, and nights and weekends is where a model like this helps as well. Thank you all for your interest in this topic and for your dedication to this population.